I'll be joined by Dr. Senyo M.K. Misrami. He is the director of Tantra Community Clinic. Good morning.
Good morning.
Now
Spiky.
Where do you hear that name from?
I know, man. I just got it.
you heard it sing, right? She's black.
Yeah.
And I just think, as two, old students of PSEC, and I'm just thinking, if I had a junior like this back in the day, like as I'm sleeping, I'll just let her just stand by the side and sing
the whole night.
She'll sing the whole night until I fall asleep. Interesting. So good job there, Sue's Black, I must say. Fantastic work. And right now, the doctor has joined us. Now, when the doctor came into the studio, you find a lot of young ladies come and wave at doctor. Hey, doctor, hey, doctor. No,
I know, right? The life of a guy.
The life of a guy.
Yes.
Anyway, before we talk about fibroids, as the life of a guy, and I'm wondering, do you sometimes, is it weird sometimes when you see your patients in town with?
I think in the beginning, when you become a doctor, sometimes after seeing people in their birthday suits and stuff like that, when you meet them, especially the immediate environment, like you examine your nurse or something, you meet them all clothed up. In the beginning, it's a bit shaky, but with time, when you appreciate women more, especially the women, when you appreciate women more, when you recognize the need to respect the fact that somebody's brought their body to you to handle and all of that, you step back and you enjoy the work more. When you see people, you don't remember what went on, but the dignity, the respect, and everything is all up here. So I think with time,
it's a more scientific process.
Absolutely.
Than an emotional.
No emotions at all.
Okay, so now we are talking about fibroids. What exactly are fibroids?
So fibroids are tumors or growths, and these growths are made of what we call smooth muscle, because of course the womb is made up of smooth muscle. Just to clarify, muscles that you have here, they're called skeletal muscles. They are stronger and everything, and they respond to different chemicals differently. But the things that are within your abdomen or within the inside of your body, most of them have smooth muscle. They respect things differently. So in fibroids, what happens is that a few cells within the womb, the womb is made up of smooth muscle. A few cells in there disrespect the order of growth, and then they begin to grow out of this order, and they don't respect the fact that they should stop growing and grow and grow and grow. So they push all the tissues around, and then they form a big ball, which is called a fibroid
within
nodule.
the womb.
Within the womb. Sometimes, fibroids can reside either within the body of the womb, or they can be within the lining of the womb. Mind you that the womb, is a structure with a cavity in it, which is called the endometrial cavity, which is where women bleed from during their menses, and which is where a baby occupies when a woman is pregnant. So some of the fibroids can push into this cavity. So these are called submucous fibroids. The ones that are within the body are called intramural. Mural means wall.
So within the body, yes, and it's not attached to any.
It's attached, but
lining.
it's within. So for instance, I'll use this. So if this is the cavity of the womb, this is the body of the womb, and this is the outside of the womb. So fibroids can occupy here and push into the cavity. Some can occupy the body or the wall of the womb, and others can be on the outside of the womb. All right, and others too can occupy the mouth of the womb, which we call the cervix. So depending on where fibroids are located, they could be classified as such. And also depending on what fibroids are causing, the symptomatology, they could also be classified as such. So you can hear things like bleeding uterine fibroids. You can hear things like degenerating uterine fibroids. These are fibroids that have grown so much that sometimes they outstrip their blood supply and they begin to die within their middle. All right, so that death of the tissue in there can cause a lot of pain.
But is that not a good thing if the fibroid is dying?
Well, if it's dying, sometimes the blood supply to the outside is still there, and it could be growing out there, but the middle, is dying. That causes a lot of pain. So you can imagine that you slept on your arm. and no blood is flowing to your arm. When you realize that it's really painful.
Yeah.
First it will go numb and later it will be painful. So that kind of phenomenon goes on in there and it gets very painful. Some of the fibroids too can have deposition of calcium and the rest. They are all called degeneration. So a fibroid can be typified by one where it occupies in the womb. So in the lining is a submucous, in the wall is intramural, on the outside is subserous. Some of the fibroids inside or outside, sometimes as they are growing, they begin to get like a stalk. So for instance, a fibroid in the lining of the womb, when it's growing out, it picks the lining of the womb like this and grows until this part forms like a thin stalk. Wow. So that kind of fibroid can keep growing and getting heavier and be dropping till one day it pushes out of the cervix and into the vagina. And that one is called an extruded fibroid polyp or submucous fibroid. You know, the ones that occupy the lining of the womb, they bleed a lot. Because you see, when they are pushing out of the lining, they cause breaks within the lining. And remember that the lining of the womb has all the blood vessels, that nourish the lining for a baby to grow and all the rest. If that doesn't happen, then a woman bleeds as a period. So when you have these cuts in there, the fibroids bleed a lot. And women lose a lot of blood. I'm sure we'll talk about the signs and symptoms, and we'll talk about those. So,
and when they lose a lot of blood, this will also come out of the vagina, and this will make it seem like a period.
As if it's a period. So they'll tell you
period.
that they have heavy periods, painful periods. There are periods that are not ending. And then sometimes the bleeding does not happen at the time when they are expecting their period. So they have bleeding in between periods.
And then they'll think it's an irregular
cycle, only for them to come to hospital and we realize that it could be fibroids. Now, talking about these fibroids that can get extruded out, they are typically the fibroids that people will go for maybe a revival or be jumping somewhere and all of a sudden that can drop because the stalk has become so thin that it could easily drop. And when these happen at revivals, you hear people shouting that I'm thinking it's a healing, all right, but that's a miracle that could have happened.
So if it drops out, you said it can drop out through the cervix, through the vagina.
Yes.
Now, if this drops out, does that mean the person is healed properly?
No, you see, fibroids grow. When you see somebody with one fibroid, it's likely that they might have other ones at different stages of development within the womb. So if you see just one fibroid, it tells you that this person's womb is likely to have a lot more fibroids, probably growing at different rates, So when you drop one fibroid out of your vagina, it might not be the end. There might be other ones that are within the wall. Those ones typically cannot drop out like that. Or on the outside of the womb, which is within your pelvis, those ones won't drop out. So the typical ones that can drop out for people to think that is a big miracle.
On an average, how many, let's say out of 10, what's the statistics? Women
in Ghana, we could be talking about 2 to 5 out of 10 women with fibroids. Worldwide, the figures are, varying. Yeah. And what we know is that fibroids are something that's happen more in people of African descent, or black origins. And especially in Africa as well, people of West African descent have more fibroids. Wow. And we realize that even in West Africa, Nigerians and some people from some parts of Ghana also have more fibroids than other people.
This thing concentrates
it's coming straight to us. So that really tells you that fibroids have a genetic component. All right. So during the time that you are being formed, from conception, you inherit genes from your mother and father. Sometimes you're happy to inherit only good stuff, but other times you inherit bad things. Now there is a controller.
Now that we are there, let's focus on the causes.
On what causes, yes.
So the genetic.
Yeah, the genetic. So the main thing is you would have inherited a gene that controls growth of smooth muscle cells in your womb. There's a gene responsible for that. And when you inherit a defect in that gene, so that gene is supposed to tell the womb cells that grow every month up to this point under the influence of hormones, and then you die off. Or you grow to this point, you reduce in size. But when the gene is defective, or like the knob in control is defective, like a trafaso, and you've inherited it. It means that when the fibroids are...
You think I didn't get a defective that you had to...
No, I'm just saying... No, I'm talking... You're a smart guy. I'm talking to everybody. So basically, when you inherit that, then when the time comes for your womb cells to grow according to order, they don't. And then they begin to grow out of order and they form these big lumps, which are the fibroids. So this is the main thing we know. Many years before now, we said that we didn't even know what caused fibroids. All right. Now we know that hormones lead to the growth of womb cells. So I'll just take you through. During a woman's cycle, the first few days when she's bleeding, up to about 14 days thereabout, she produces hormones from the developing eggs. Now, these hormones sometimes let the womb cells grow a bit. They get bigger a bit, you know. And then just about the time when the woman ovulates, some sort of, recession comes in and the cells go back to how they were. So every month, the cells obey this kind of order from the hormones. Now, with somebody who's inherited a defective gene in the womb, what happens is that the hormones come in, instead of causing a little growth and going back, the cells grow more.
Wow.
Each time there's an additive effect until they grow. So you realize that women who have inherited the gene that will make them grow fibroids will only start getting the fibroids when their period set in. So girls, before their menses, you won't hear anything about fibroids, usually.
Okay. So that when it comes to causation, that's the main
so the hormones cause the cells to grow, but you'd have inherited the gene. Then there are other things as well. Eating red meat, for instance, eating animal products, animal fat and the rest, or increasing in body weight. These are all known to feed these cells that have inherited the defective gene and then make them grow more. So one is genetic. Two, there are risk factors that could increase their occurrence. So for instance,
if you have not inherited such a gene,
you might not get fibroids.
So irrespective of your lifestyle choices.
Well, we might not, but remember that there's a chunk of fibroids that happen and we don't know what the cause is.
Wonderful.
So sometimes it might just come out of the blue and we can't link it to even genetics. All right. Now, because we know that exposure to hormones during your menstrual cycle feeds these cells to become fibroids. And it means that whenever there's a respite period, wherever there's a period where you don't get, say, periods, your menses, then these cells will relax a bit. So you realize that women, when they hit menopause, because they're not getting periods anymore, they're not getting the hormones that feed the fibroids begin to regress and slow down in growth and size. All right. Now, the same goes for a woman who, for instance, has had periods many years without a break. Sometimes a break comes in with pregnancy. So a woman who started her menses from 9 years, is 36 years, has never gotten pregnant and held it to 9 months. It means that she's been exposed to these hormones month after month after month. So you realize that women who've kept themselves from getting pregnant for many years, they are the people we discover in their 30s.
Wow, they stand a higher risk of getting wow, this is serious. Now, I'm also informed that some sort of foods you eat, actually, if you have some fibroids already, the choice of foods you eat, maybe starchy foods or food with high carbs, I don't know, you tell me, can actually facilitate the growth of these fibroids.
Absolutely, yes. So, I mean, it's good we mentioned animal products, animal fat. The other thing is what we call foods with phytoestrogens. Now, estrogen is this hormone we said is responsible for the growth of the fibroids. So phyto means plant. And there are certain foods that have high content of phytoestrogens. Taking over a long period of time could increase, the growth of the fibroids. Generally, eating a lot and gaining weight. So people who are obese are more likely to have bigger fibroids or fibroids growing faster than other people. So by that, I don't mean to condemn any food, but the typical food with high phytoestrogens are soy and soy products. So people who drink a lot of soy milk and the rest. But, I haven't seen a big research on this. So when I'm saying these things, I say with a bit of caution.
Okay, now, is there any way to prevent
fibroids? Right. So the dietary aspects, one. But you see, if there was a way to avoid getting fibroids, you should come out as a man. Then you don't have a womb, and you won't get fibroids. But in the unfortunate event that you've inherited a gene that is responsible for it, you can slow down, the growth. By one, watching your diet, reduce your diet to eating fruits, vegetables, less animal products and the rest, less phytoestrogens like the soy products and the rest. And then checking your weight as well. These could lower, the rate
chance
of
of
growth. Then also starting families early. As well, yes, and not spacing your children too far apart. Because each time you are pregnant for 9 months, the fibroids have like a slowdown. Yes.
Okay, so now I'm thinking of if you have you already have the fibroids,
yes,
and then you have them taken out, maybe surgically, you have them taken out. Sometimes it recurs. Is this normal?
When people say that fibroids recur, and we too erroneously sometimes say recurrent fibroids, it's just a misnomer. Like for lack of a better description, we say that they have recurred. But actually, what happens is this: you have a womb that has fibroids in there. Some of the fibroids are at the stage where the gene is playing its tricks in there. And it's just a cell. And remember from science, which you and I did, you can't see a cell with your naked eye.
Of course not.
All right. So there will be fibroids that are about to grow from one cell stage, which the eyes can't see at the time of surgery.
So at
the time of surgery, you remove fibroids as small as this, or even smaller, or obviously big ones. But the ones that are at one cell stage, your eyes will not see them. It's only a matter of time that they will become bigger.
Can a fibroid grow bigger than the womb?
Yes. On the average, the height of a womb should be between 7 and 9 centimeters. Its width 3.5 to about biggest 5. Right. Now, fibroids can grow to about 20 centimeters.
Wow.
I've seen a fibroid bigger than a baby.
Wow.
Recently, we took out a fibroid that was bigger than my head.
Wow.
So, yes. So, fibroids can get really, really huge. They feed on blood supply. Mind you that if you divide the womb into 3, most of the blood supply goes to the lining, the rest goes to the middle, and the rest to the outside. So fibroids that occupy the middle of the womb, the wall, and those that are within the wall of the womb, they tend to grow a lot. And sometimes fibroids that are on the outside can, mop up blood supply from other structures to come and join them. And those
so this would eventually cause maybe
the abdomen to get distended. I'm sure you are like drifting into signs and symptoms, so we can quickly
so let's wrap up with the signs and symptoms.
Yes. So how would somebody know that they have fibroids? Half of people who have fibroids might not even know. So the fibroids are tiny, they are in the womb, they are not causing any problems, your periods are not affected, so you don't even know you have fibroids until we scan you and probably see it. So that's one half. The other people will get some symptoms. One of them could be pain. Remember we said that fibroids could also be typified by how they are behaving. So degenerating fibroids cause a lot of pain, especially very painful when you are pregnant.
Okay.
You see, when you are pregnant and you have fibroids...
Let's summarize it.
Yes. Okay, so we can go to the rest. So you can have pain. You can have a lot of bleeding, like we said. You can have bleeding that goes beyond the number of days you do. You can have bleeding that comes when you are not even in your period. You can have bleeding that is so much that you are always fainting, getting tired, and anemic. You can have bleeding that can make you collapse as well. So then you can have fibroids that are grown so big that they are causing a cosmetic disfigurement, as in they are protuberant, and then your tummy looks big. Sometimes you can have movement in your tummy when there's no baby or anything. It's because there's a fibroid sitting on top of the womb and it swings and sways as you move about. Then fibroids can also cause what we call pressure symptoms. So a fibroid can be so big, it's pushing your bladder in front. And so each time your bladder is not even full enough, you feel like urinating, you go and quickly have to go back and all of that because of that pressure. Fibroids can also cause pressure on their backdoor neighbor, which is your rectum. So they can close the rectum, cause constipation, or be irritating the rectum, causing diarrhea and the rest. So in a nutshell, this...
So when you have all of these symptoms, it's always advisable. So your final advice would be that people should, ladies...
Yes, should see their doctor. I mean, I think that in every year you should have a scan to see. Now that we know that this part of the world, we have more fibroids, you should see a doctor once in a year just to look out for fibroids. If you are trying to get pregnant, and it's not happening, or you are getting recurrent miscarriages, or you are getting any of these signs and symptoms that we've described, it's worth going to see a doctor to find out. Fibroids could just be the culprits.
Thank you very much. Dr. Senyo M.K. Mr. He is the director for Tantra Community Clinic, and of course the social media handle is Dr. Senyo on all social media handles, Twitter, Instagram, and of course Facebook, Dr. Senyo, DRSENYO. Thank you very much for joining us.
Always welcome.